Jane Halton, as we've just heard, the national plan was only ever a roadmap for how restrictions could be removed as vaccination levels increased. Does Australia actually have a system of emergency management in place for the health sector, for dealing with something like a pandemic, in the same way we do for bushfires or floods, which anticipate what might be needed?
We've had a national plan to prepare for pandemic influenza probably for about 15 or 16 years. But as with all plans, they need to be updated, and that's the WHO recommendation. But a national plan in relation to a broadly focused public health crisis of this kind, no, we haven't had historically that kind of plan.
Well, can you give us some sort of feeling, in the absence of such a plan, what sort of scenario or contingency planning might have been occurring in the bureaucracy over the past couple of years?
Well, one of the things that you need to be prepared for is all sorts of different scenarios. And I think that's the lesson that we've been learning probably for the last 20 or 25 years. Pandemics, be they influenza or otherwise, are unpredictable. So being prepared for a coronavirus, if you're in Africa, Ebola, of course, is an issue, influenza, et cetera, having the ability to deal with a number of different kinds of scenarios mean that you're able to respond really quickly. And of course, when supply chains become choked, you've actually got a ready reserve of things you need to use, and you need to use quite quickly. So actually doing that kind of forecasting, that scenario planning, and then exercising that plan, practicing, is really important.
We've obviously got a particular issue here with the Federation, and we've often see this question about who's responsible for what. But given the need to act quickly in these sorts of circumstances, do you think the lesson of the pandemic is that we really should rely on the federal government being able to have more of a sort of a say of just going, right, well, these are the things we need as a nation, and we've got to get ahead with doing that, and we'll just do that and we'll sort it out with the states later?
Well, absolutely. The last thing you want to be doing is argy-barging about who's paying for what at a time of crisis. No one is going to forgive you if you're slow to respond. One of the reasons we established the National Medical Stockpile now, literally 20 years ago, was precisely to be able to fill gaps and move quickly, and particularly to be able to supplement the states and territories in terms of things that they needed at a time of crisis. And that kind of crisis could be influenza, it could be in relation to a biological or terrorist attack, or it could be, as we saw in Fukushima, something where you need radiological response. So that is exactly why you have a national response such as the National Medical Stockpile.
Well, as you say, you were deeply involved in establishing that stockpile, and it played a very big role, particularly at the beginning of the pandemic. But do we need to consider a broader role for it in the future, do you think, given the nature of the pandemic we've seen in the last 20 months?
Absolutely. And one of the things that we hope when we get to the other side of this pandemic, and in any event people should be thinking about this now, is what else should we be prepared for? Because, of course, every time we go through one of these events, we learn. And what we learn is we need to do more, and we need to be better prepared. And we need to think about those scenarios we've already talked about to make sure that we've got those supplies. In some cases, those supplies will never be used. In some cases, they're going to be used, sadly, more often than we might anticipate. But thinking through what's needed and making sure that we've purchased those, we've got them stored, and then we can bring them out if and when we need them.
Well, finally, you were also tasked with reviewing the hotel quarantine system on a couple of occasions. Given how widespread Omicron is in the Australian community, does having closed borders serve any purpose now?
Well, I think there is a question. When we actually have a higher amount of disease, Omicron, in our community than we have actually in the UK or in the United States, you have to ask yourself, what is the effect or the appropriate approach to managing our border? A number of other countries have moved to ask people to test on arrival. Of course, if they're COVID positive, having them isolate. I, for one, think given the number of the shortages we're facing, particularly in workforce, I think it is time to reconsider how we manage those border requirements, because at the moment, I think it's absolutely unarguable that they're not necessarily helping us manage this pandemic, which is what they were established for in the first place.
Jane Halton, thanks so much for your time tonight.
Pleasure.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.